So basically the Webster Technique, a relatively gentle procedure that is actually much safer than the typical approach to turning a breech baby. Basically I'd go through a quick check, just checking primarily the pelvis and the sacrum because our main goal is to keep that all moving properly to provide the most space for the baby basically to allow them to flip back head down essentially. So babies are top heavy more or less, so if you give them that space they can turn on their own more or less is kind of the goal for it. But yeah, so essentially what I'd be doing is I'd be checking the tension of your sacrum and pelvic ligaments, and we do that basically just by bending your knees up. And I'd just be checking to see if there's tension on one side or another. Typically, in the case of a breech baby, that you'd have a locked up pelvis on one side essentially. See is one leg would be able to go down a lot farther and one would be more restricted here and be tight almost. So that'd be an indicator that we need to work on that. Do that through two different ways. One, I'd actually do an adjustment for your sacrum or your tailbone essentially. So the area we'd be working on is basically right down in the middle where a lot of people call it kind of the small of the back. And work kind of right down below that. So I'd be checking to see how that's moving side to side, basically pushing side to side here. And yours is actually a little bit restricted, moving right to left. So that's kind of the way I would adjust it from that point.
Okay.
So to do that, we would use either basically light force instruments or what's called a drop table. We're going to turn that down for you. And it'll just drop away like that essentially. So it's just moving about a half an inch or an inch or so. It's arthrostem's basically like a mini jackhammer essentially that we can be basically really gentle with it or really strong with it to kind of shift that back into place. But most of the time it doesn't take much force at all, and we always go by the tolerance of the patient.